Hi everyone, my name is Ali. I'm one of the dietitians in the Rotunda. You're very welcome to the Nutrition in Pregnancy video. We all know that eating well during your pregnancy is important for growth and development of your baby. But what a lot of people don't know is that what you eat now can influence your child's lifelong health. This is because their genes are being programmed in the womb. So for example, eating a healthy diet now can influence a child's risk of obesity and diabetes right into their adult years. So it's a really important time. This is called the Barker hypothesis for anyone who is particularly interested. We've all heard the phrase eating for two in pregnancy. Unfortunately, in terms of energy requirements, this is not quite the case. In the first trimester, we require very little extra energy. In the second trimester, it's around 300 extra calories we require. So that might be some extra snacks like a banana, a yogurt, and a handful of nuts. In the third trimester, it might look like 450 or 500 extra calories every day. So maybe a sandwich with a yogurt and a piece of fruit. Not quite doubling all our portion sizes. Saying that, our requirements for some nutrients increase quite a lot. For example, protein, iron, and omega-3 fatty acids. This means that we want to choose quality over than quantity when it comes to food, to make sure we're getting all of these nutrients without too much extra energy. In the following slides, we'll go through a range of nutrients that are important through your pregnancy, as well as some common problems in pregnancy that nutrition can play a role in. We'll start with carbohydrates. Our poor carbohydrate foods have gotten a bad name in recent times, with lots of low carb and keto diets becoming popular. We don't recommend following these diets through pregnancy. Carbohydrates are our body and our baby's preferred source of energy. We recommend having about a quarter to a third of your plate as a whole grain starchy carbohydrate in each meal. Whole grain options have more vitamins and minerals, and the fibre can help to prevent constipation, which is very common during pregnancy. As well as that, high fibre foods help to keep our blood glucose or blood sugar levels more steady, and this can reduce the risk of gestational diabetes later on in your pregnancy. Fruit, milk, and yogurt are also healthy sources of carbohydrate. We don't necessarily need the free sugars for good health, so keeping these foods to moderation is a good idea. Protein is an important nutrient for growth and development of your baby, especially during the second half of pregnancy when growth speeds up. Our protein-rich foods include meat, fish, chicken, eggs, lentils, beans, and nuts. We recommend 2 servings per day of protein-rich foods in the first half of pregnancy and 3 servings per day in the second half of pregnancy. A serving of meat or chicken is about the size of the palm of your hand, so you can imagine women don't usually have an issue reaching their protein requirements because in Ireland our typical portion sizes tend to be bigger than this. Women with twins need about 4 servings of protein-rich foods per day, so ensuring they include 1 or 1.5 servings of protein with each meal is a good idea. The nutrition section of the Rotunda website has a handout with more information on portion sizes. As much as possible, we recommend that women choose less processed protein choices, such as fresh and lean cuts of meat, fish, or chicken, plant-based sources like lentils, beans, and that you limit your intake of processed proteins such as bacon, sausages, and chicken nuggets, as these foods tend to be higher in unhealthy fat and salt. The use of protein supplements is not recommended during your pregnancy. This includes anything like protein shakes, pancakes, protein bars. At either end of the spectrum, too much or too little protein isn't good for a growing baby. And these things haven't been around long enough to be proven safe to take in pregnancy, so we do not recommend that you take them. Fat is another one that many people think of as an unhealthy nutrient. However, there are many healthy fats such as plant oils, avocados, nuts and seeds, and oily fish that are really important to include during your pregnancy. They're a good source of energy and are key for certain aspects of development. The problem is we tend to get most of our fat from the less healthy fats, like fast foods. We want to reset the balance so that we include more of the healthy fats and less of the unhealthy fats. One of the most healthy fats during pregnancy are omega-3 fatty acids. These play a key role in a baby's eye and brain development. They're also important for mum's heart health. By eating oily fish, such as salmon, mackerel, or trout, once to twice a week, we get enough omega-3 fatty acids for pregnancy. There are vegetarian sources of omega-3 fatty acids, such as walnuts, rapeseed oil, and flaxseed. However, it wouldn't be usual that you would get enough of these to get enough omega-3 in your normal diet. So if you do not eat oily fish, we recommend that you consider taking an omega-3 supplement. We recommend that all women who could become pregnant take a folic acid supplement and to continue to take that throughout your pregnancy. That comes from a new guideline just last year. Early pregnancy, folic acid supplementation can help to reduce the risk of neural tube defects such as spina bifida and anencephaly. Most women need 400 micrograms of folic acid. Some women need a higher dose of 5 milligrams before pregnancy and for the first 12 weeks. This includes women with a pre-pregnancy diabetes, higher body mass index, or have had a previous birth affected by a neural tube defect. Women taking certain medications will also need this higher dose, so make sure to have a chat with your healthcare professional if you think you fall into one of these groups. We also get plenty of folate in our food, for example in fruit and vegetables, cereals, beans and pulses. On the next slide we're going to talk about iron. This is one of the most important nutrients in pregnancy. Very often women are concerned about protein intake, but it is far more common that they are deficient in iron. Iron carries oxygen in the blood, so it helps to prevent anemia and brings oxygen to the baby. It is key in brain development, and studies show that when mum's iron stores are good through pregnancy, babies tend to be a healthier birth weight. From week 25, your baby starts storing their own iron for the first 6 months of their life, or until you wean them onto solids. Iron-rich foods include meat, fish and chicken, particularly red meats such as beef, lamb, pork and mutton. We absorb the iron from these foods really well. Other foods such as eggs, dark green leafy vegetables like spinach and broccoli, fortified breakfast cereals and beans are also good sources of iron. However, we don't absorb the iron from these foods as well as we do that from meat. We can help our body to absorb the iron by eating them with a source of vitamin C. So for example, if you're having eggs at breakfast, you could have them with a glass of orange juice. We check your iron stores at your booking visit. If your levels are low, the midwife will have sent you a letter recommending that you take a high-dose iron supplement, such as Ferrograd C or Galfer, to help increase your levels. If you are taking this supplement, try to take it 30 to 60 minutes after a meal, because it can help with other nutrients for absorption. If you did not hear anything, it usually means your iron levels were okay. A no news is good news policy. Many women will choose to take a maintenance dose of iron. This would be a supplement containing around 16 to 20 milligrams, and this can help to keep their levels normal. This would be the usual amount of iron found in a pregnancy multivitamin. On the next slide, we'll talk about calcium and vitamin D. Calcium is important for both mum and baby's bones and teeth, and also for mum's blood pressure. During pregnancy, most women need at least 3 servings of milk, cheese or yogurt, or fortified non-dairy alternatives, to meet their calcium requirements. A portion of calcium is 200 ml of milk, a standard 125 gram pot of yogurt, or about 2 thumbs size of cheese. Women carrying twins will need 5 servings per day. This also applies for anyone still in their teenage years. We can also get calcium from sardines and plant-based sources like green veg, nuts and beans, but we don't recommend relying on these sources for your calcium intake during pregnancy. Vitamin D is required to absorb calcium, as well as having a range of roles in your immune system and in your baby's development. Sunshine is our major source of vitamin D, and unfortunately, living in Ireland, that means none of us get enough vitamin D. For this reason, we recommend that all women take a 10 microgram vitamin D supplement daily. Some women may need more. What we can say for now is to take your supplement and also eat oily fish, drink fortified milk, and eat eggs. Iodine is a key nutrient in brain development and one we don't hear about enough. Your iodine requirements increase about 50% in pregnancy. This is a major increase when comparing it to other nutrients. Iodine is found in white fish and seafood, such as cod and prawns, and in other dairy foods. Women eating a balanced diet normally don't have an issue reaching their iodine requirement. Iodine is also included in most pregnancy multivitamins. It is important to keep hydrated during pregnancy. Make sure you're having at least 8 glasses of fluids per day. Good options are water, still or sparkling, milk, squash, fresh juices or smoothies. If the weather gets warmer, make sure you're drinking even more than this and always carry a bottle around with you. In order to get in all of these important nutrients, we recommend having 3 main balanced meals, and most women will need 2 to 3 healthy snacks between meals. This picture shows the plate model. At meal times, aim to have about half your plate fruit or vegetables. The new food pyramid guideline recommends 5 to 7 servings every day, so they should be a major part of our meals. About a quarter of the plate should be a whole grain, starchy carbohydrate, and about a quarter should be protein. So let's look at breakfast as an example. Your carbohydrate could be porridge oats. Making them on milk adds some protein. You can further boost that by adding some seeds or nuts. And then you might put bananas or berries on top for the fruit component. If you're having toast, you could have eggs with it for protein and a glass of orange juice for fruit, or tomatoes and mushrooms to boost the veg. Regardless of your body mass index, we recommend limiting your intake of confectionery, fizzy drinks, and fast food in pregnancy. There are a few reasons for this. Firstly, these foods can displace nourishing meals and snacks. For example, if we snack on a bag of crisps, we take in what we call empty calories, whereas if we snack on crackers and cheese, we get energy, protein, calcium, and many other vitamins. The other reason for limiting our junk food goes back to that idea of genetic programming that I mentioned at the beginning of the video. Studies have shown that really excessive intakes of these foods may alter a baby's genes, and they may be programmed differently, and then they are more prone to obesity and chronic disease such as diabetes later in their life. As much as possible, snack on nourishing foods and try not to eat these foods every day. On the next slide, we have a list of healthy snack ideas to replace junk food. It's a good idea to have the kitchen stocked up with these kinds of snacks and to avoid buying packets of biscuits and multi-packs of crisps and that. Food safety is a contentious issue in pregnancy because there are different guidelines here in the UK and different guidelines again in the US. In Ireland, advice currently says that eggs are safe to eat as long as they are well cooked. In terms of caffeine, less is more. We recommend to limit your intake to no more than 2 cups of caffeinated coffee or 4 cups of tea per day. Decaf varieties are fine after this. Plenty of cheeses are safe to eat in pregnancy. You should avoid unpasteurized, soft, and mold-ripened cheeses, such as brie, camembert, and Stilton. Hard pasteurized cheeses are safe to eat. For example, cheddar and Edam. Mozzarella, cottage cheese, and spreadable cheeses are also safe. Irish guidelines recommend avoiding smoked salmon during your pregnancy. You should avoid liver and liver products such as pate and cod liver oil supplements during your pregnancy. The reason for this is that we store vitamin A in the liver, and at very high doses, vitamin A can cause birth defects in the baby. Now, these are really high levels, but to err on the side of caution, we recommend avoiding these things. Plenty of fish and seafood are safe to enjoy. You should avoid shark, swordfish, and marlin due to the higher mercury content in these fish, and avoid oysters and mussels due to potential toxins. Tuna should be kept to no more than 1 fresh tuna steak or 2 medium tins of tuna per week. All nuts are safe to eat during your pregnancy unless you yourself have a nut allergy. The other one to avoid is soft whipped ice creams such as 99s. You're safer to go for something out of the freezer if you're going to treat yourself. We've already touched on many of the supplements, but just to summarise, all women should be taking a folic acid supplement. Iron we spoke about. If you received a letter to say your levels are low, you'll need a high dose supplement, such as Ferrograd C or Galfer, and otherwise you may choose to take a maintenance dose. An omega-3 supplement should be considered if you don't eat oily fish, Everyone living in Ireland should be taking a vitamin D supplement. And the easiest way for most women to get all of these is just by taking a pregnancy multivitamin. Most brands contain the same amounts of vitamins and minerals. Some will come with extra omega-3 and some varieties with calcium. You can ask your pharmacist if you require any help with these, or feel free to contact our department. I'll put up the contact details at the end of the video. The bottom line with supplements is that they're safe to take in pregnancy. So if it's not a pregnancy-specific supplement, make sure you check the label to see. Physical activity is as important in pregnancy as it was before. The guidelines are the same in pregnancy. That is at least 150 minutes spread through the week. You can break this up in a way that suits you. For example, 30 minutes 5 days a week. You can split that time up too, getting 10 minutes in on your way to and from work and getting out at lunchtime for a short 10-minute walk. Many women like walking or swimming, particularly towards the end of pregnancy, when you're not used to the extra weight on your body. Antenatal yoga and Pilates are popular too. If you're going to start a new exercise, make sure you check with your doctor or midwife first. Nausea and vomiting are common early in pregnancy and for most women ease off by the second trimester. Leaving long gaps between meals can make your nausea worse, so try to nibble small amounts of food frequently throughout the day. There's nothing off the menu when you're sick. For most women, it's dry, bland carbohydrates that are easiest to eat. Foods like dry crackers, biscuits, toast and cereal. Have the presses stocked up with these. Listen to your cravings if you're sick. It's always better to eat something rather than nothing at all, even if it's not the healthiest. It's important to note that many women go off foods during this time, so don't be hard on yourself if your diet isn't as healthy as you would like. Just do your best to keep your intake up. Fluids can be difficult to drink too when you're not feeling well. Aim to sip about 200 ml of fluid every hour or two. Try changing what you're drinking. Sometimes water is the hardest thing to drink. Some women find very cold fluids easier, or even to just suck ice cubes or ice lollies. There are safe medications available for women with very bad nausea and vomiting. Talk to your doctor about these. If there is ever a time you can't hold down food or fluids, make sure you come into the emergency room. Here we have a sample meal plan for someone who's really sick and unable to eat their usual meals. Try bringing some dry crackers to bed with you. Eat 1 or 2 of them when you wake up. Wait about 15 to 20 minutes in bed and then really slowly get up. Every hour after that, try to have something small. Heartburn is problematic for many women in pregnancy. I'd love to say it's all about diet, but really reflux or heartburn is best managed medically, whether it's something that's over the counter from your pharmacy or something stronger prescribed by your GP. Certain foods can trigger your reflux. Anything very high fat or greasy, like a chipper, or spicy, like a hot curry. You may find it's just not worth it to eat these foods anymore. Chocolate can also trigger reflux for many women, or too much caffeine, like too much tea or coffee, or fizzy drinks. Avoiding your triggers helps many women. Splitting your meals into 6 small meals rather than 3 main meals can also help. If you are someone who has very bad reflux at night, try eating your main meal at lunchtime and then snacking your way through the evening. At night, try to prop the pillows of your bed up so that you're sleeping about 45 degrees. Gravity has a big part to play here. The same goes for sitting upright after meals. I know that sounds silly, but we can often lie on the couch watching something on TV after dinner, so make sure you sit down for about half an hour or 40 minutes. And finally, just loose and comfy clothing can be really helpful. When preventing constipation, we talk about the 3 Fs: fibre, fitness and fluids. Looking at fibre, are you getting your 5 to 7 portions of fruit and veg every day? Are you going for nice high fibre options like whole grain breads and high fibre cereals like Weetabix and porridge? Lentils, beans, nuts and dried fruits can all be great ways to get extra fibre in your diet. Further than this, a glass of prune juice daily helps most women. If you've tried all of the strategies mentioned and want to try something new, try adding some ground flaxseed or linseed to your cereal, porridge or yogurt. Start small with 1 teaspoon and slowly increase up to 2 tablespoons, or until you feel an improvement before that. When we increase our fibre, it is so important that we increase our fluid intake. Fibre needs to absorb fluid to pass through the system. So if we increase our fibre without increasing fluid, we can actually make things worse. Make sure you're drinking 12 or more glasses of fluid daily if you're in any way constipated. And finally, fitness. Exercise increases the blood flow around the whole body, including to your bowels. So make sure you're getting out for your 30-45 minutes gentle exercise most days. Some laxatives are safe to take in pregnancy, but not all of them. So make sure you talk to your doctor or pharmacist if you're considering taking one. Gestational diabetes is a form of diabetes that occurs during pregnancy, leading to high blood glucose or sugar levels. All women who fall into a high-risk category will be tested with a glucose tolerance test. This includes anyone with a body mass index over 30, older maternal age, any family history of diabetes, a previous baby over 4.5 kilos, certain ethnicities, and certain medical conditions, for example, polycystic ovary syndrome. You can reduce your risk by eating healthy, regular meals, each with a source of whole grain carbohydrates, reducing your intake of free sugars, such as chocolate, biscuits, cakes, fizzy drinks, exercising frequently, and a healthy rate of weight gain in pregnancy. On the next slide, you'll see what we expect when it comes to weight gain. Everybody gains weight very differently in pregnancy. We don't expect to see too much weight gain in the first trimester. From the second trimester onwards, what we expect to see is based on your pre-pregnancy body mass index, or BMI. If you entered pregnancy at a normal body mass index from 18.5 to 24.9, we expect to see about 0.4 kilograms or 1 pound weight gain every week from the second trimester onwards. If you were underweight in pregnancy, it is a little bit faster and a little bit more weight overall. If you entered pregnancy overweight or obese, it is a little bit slower or a bit less overall weight gain we expect. This slide is just a guide. You will have weeks where you gain more or gain less. Regardless of body mass index, we don't expect to see weight loss for any woman. If you're actively losing weight, please talk to your doctor or midwife or contact the dietetics department in the Rotunda. Food hygiene is the same as normal. It just becomes more important than ever when you're pregnant. Wash your hands really well before handling your food. Wash your fruit and vegetables really well too. Store cooked and uncooked foods separately and have different chopping boards for cooked and uncooked meats. Make sure your fridge and freezer are cold enough. Less than 5 degrees for the fridge and less than -18 degrees for your freezer. For up-to-date advice on food safety, you can visit the Safe Food website. Breastfeeding has numerous benefits for both mum and baby. It can help mum return to her pre-pregnancy weight, as well as reducing her risk of type 2 diabetes, breast cancer, and osteoporosis. It is free, and there's a really special bond between mum and baby. For baby, breast milk is the best start to life. It contains all the nutrients they need in the right amounts, except for vitamin D. Just like you, your baby will need a vitamin D supplement if you're breastfeeding. What's really special about breastfeeding is that mum passes on her good bacteria to baby, and studies show that this means babies get sick a lot less. They also have a reduced risk of obesity and chronic disease. Coming to the end of our video, we have a few take-home messages. Yes, you are eating for two, but more in terms of quality over quantity. Variety is key to make sure you get in all of the nutrients you need. It is never too late to make a positive change. Many women struggle with food early on in pregnancy and don't feel like eating a healthy diet. That's okay. Once you're feeling a bit better, try to make a few small positive changes. And if you're really struggling, make sure you contact us. But most of all, enjoy your food. Thanks for watching, everyone. Feel free to contact the dietetics department if you have any questions or concerns over the coming weeks. Our phone number is 01 817 2550.